So you found out that you have a leaky gut or trouble with your intestinal barrier. What are some things that can lead to that? One of the number one things in our society is actually chronic use of antibiotics. Every time that we use antibiotics, we actually change our microbiome or the bacterial composition of our gut, and that can actually be one of the reasons that our intestinal permeability increases. Number two is herbicides and pesticides. These can actually have damaging effects on the cells that line the gut and increase intestinal permeability and therefore increase leaky gut. The other thing can be the types of foods that we eat. So if we eat a lot of foods with certain bad preservatives, for instance, there's one preservative called BHT, and the chemical formula is BHT with a dot. That dot means free radical. Free radicals are things that really damage things. They're electrons that are looking for a home. And as they look for a home, they're kind of like a teenage boy on prom night with no date. They're running into things trying to find another electron. And as they do that, they cause a lot of damage, including to things like your gut. So foods with preservatives can be one of those things. Eating a diet that does not have nutrients but is full of simple sugars can also do that, because that can also change the microbiome in your gut to something that's not favorable, something that's full of yeast, full of disadvantageous bacteria, and that can end up causing damage to your gut. Now, there's also some talk about lectins, which are parts of plants that can cause damage to the gut. And the truth is, lectins are a mixed bag. They have some great data, like decreasing the risk of cancer in some studies, but too many lectins can actually damage the cell walls of the gut and cause inflammation. So one of the things that I look at is lectins to an extent, but there are ways that you can decrease lectins. For instance, pressure cooking your food or decreasing the amount of grains that you eat can decrease the amount of lectins that you're exposed to. So there's several things that can damage the gut barrier. The other thing that a lot of times gets overlooked are hidden infections, which are not caught on regular testing. So a lot of parasitic infections, a lot of chronic bacterial overgrowths are not caught on regular testing, and these can also be damaging to the gut barrier. The way that we treat them often can be antibiotics and conventional medicine, which then again takes us back to antibiotics damaging the gut. And so in functional medicine, a lot of times we use herbs and dietary means to look for and correct these issues. If you really want to take a deep dive into gut health, be sure to pre-register for my upcoming gut health webinar. The link is in the description below. This has been Dr. M.